Welcome to this piece of information. This is how everyone, patients, providers, and virtually everyone can be part of the cancer solution. First, make no mistake, cancer survivorship is improved. The death rate has declined 33% since 1990, and there's up to 18 to 20 million cancer survivors at present. So rehab and helping cancer patients is now becoming more and more important. And why physical therapy and rehab in general is essential for the cancer patient is the next 5 reasons. First and foremost, as reported by cancer patients, the number one complaint of theirs is cancer-related fatigue, known as CRF. And the number one best evidence-based treatment for CRF is exercise, which is the wheelhouse of physical therapy. The second reason is exercise and exercise management is helpful and essential in the recovery of the cancer patient at any stage of their treatment or their recovery on their cancer journey. The third reason is cancer patients fall down more than most patients, most everyone, particularly if they've had chemotherapy. Physical therapy and rehab are the fall down prevention experts. We want to keep the cancer patient from falling, making their condition worse. Fourth is a very commonsensical piece of information everyone should understand. Cancer cells cannot exist in an oxygenated environment. Oxygen kills cancer. And related to that, physical therapists should also understand that breathing is the number one worldwide self-directed treatment for control of pain. So therapists are ideal at coaching and training and putting that cancer patient in charge of how to breathe properly and change the course of their recovery simply by ensuring that they understand this important part of their rehab. Teach them breathing. And the fifth basic reason is what physical therapists and all rehab professionals do as part of their job is they make individualized program per diagnosis per patient. This is more important even with the cancer patient. This is not a hip replacement or a knee surgery where you do a standard set of exercises. The cancer patient may have a wide-ranging set of side effects, and they may need to plateau or maintain their function or do different things where the therapist becomes essential at individualizing their treatment program to ensure they return to their previous level of function. So do what you do as a good rehab professional, individualize their program. Now over here in the bottom corner where there's a light bulb, this really needs to be a team approach for the cancer patient. This is a shout out to administrators and marketers that this is a huge source of untapped revenue. Basically 20 million people, all with insurance, that are not being served. So it's essential that your group not fall behind in reaching out to this underserved patient population. Other than Pori, there are 2 large corporations that are actively working with oncology rehab therapists to treat cancer, and that includes City of Hope and Select Physical Therapy. I only mention them to let all you people out there know that you will fall behind these larger corporations if you do not start to market with your local group to your local physicians, oncologists, and even your local families and patients that have cancer so that we get the referral into rehab. And on a personal note, if you have a friend or a loved one that has cancer, intervene or encourage on their behalf to their oncology physician or to their family physician that has diagnosed them with cancer to get a referral to physical therapy early in their diagnosis or at point of diagnosis, simply because of these 5 major reasons. Physicians are willing and ready to refer. They just sometimes need a little encouragement to help that cancer patient get back to their prior level of function. And rehab is the way to go. And by understanding this information, all of you who have just heard this will now officially become part of the cancer solution.